Greetings, my name is Aaron, and I will be talking about borderline personality disorder today. What is borderline personality disorder, is what you might ask? Well, borderline personality disorder is a form of mental illness which tends to result in poor and unstable relationships because of the affected person's inability to manage their emotions. Borderline personality disorders are generally given its name because it leaned on a gray area of psychosis and neurosis, thus being borderline. It was also originally considered a deviation of bipolar disorder. However, the mood swings of borderline personality disorder involves shorter periods of time in comparison to bipolar's longer episodes. The following are symptoms of borderline personality disorder according to the Diagnostic and Statistical Manual of Mental Disorders and Treatment, or DSM for short. Some symptoms are constant self-criticism because of poor self-image. Conflicted relationships are identified with extremes of idealization or devaluation. Unstable emotional states, frequent feelings of emptiness, and finally engaging in reckless behavior. Speaking of reckless and potentially self-destructive behavior, BPD can affect people even if it may not seem like it on the outside. Most people with BPD can function normally in public spaces. However, once they get some privacy, it can take a turn for the worse. Those with BPD tend to have substance abuse issues because of their impulsive and self-destructive behavior. BPD can result in multiple disorders for a person who is affected by it. Depression and anxiety tend to be other disorders that accompany BPD. Research for the causes of borderline personality disorder is still in its infancy stage, and there hasn't been much development on it yet. However, genetic and environmental influences do increase the risk factor of BPD cases in persons. Events in childhood such as trauma, abuse, neglect, bullying, and etc. can also increase the risk factor of BPD. Potential treatments for borderline personality disorder tends to involve therapy, specifically talk therapy. Talk therapy is a top priority as a choice for treatment when it comes to BPD. Treatment is effective in reducing the self-destructive behavior and recklessness of BPD. However, some other symptoms may linger. The major forms of talk therapy for BPD are dialectical behavior therapy, which is centered on teaching people with BPD how to control their emotions and maintain relationships. This is shown to be the most effective treatment for borderline personality disorder. Mentalization-based therapy is another form of therapy which is focused on helping people with BPD learn to empathize. Transference-focused therapy is the last form of therapy which is based around the patient practicing to keep a normal relationship with their therapist so they can get used to dealing with relationships outside of it. Well, that's all you really need to know for borderline personality disorder. I hope you learned something new today, and thanks for watching.